This is Dr. Kayla White, and I will be discussing schizophrenia. Schizophrenia is characterized by thought disorders. It can reflect a break or splitting from the emotional side of one's personality. It's characterized by positive and negative symptoms, including auditory hallucinations, paranoid delusions, and cognitive deficits that may have devastating effects on the individual and the individual's family. Negative symptoms and cognitive alterations in schizophrenia are proposed to result from a reduced dopaminergic neurotransmission in the mesocortical dopamine pathway. The symptoms of schizophrenia are currently divided into three broad categories: positive, negative, and cognitive symptoms. Positive occurs during a psychotic episode when an individual loses touch with reality and experiences something that should be absent, such as hallucinations. Negative, those are characterized by disruptions in normal emotional states and expressions. And then cognitive is fairly common and involves problems with thought processes that severely impair the ability to perform routine daily tasks that involve attention, planning, and social skills. You will also see hallucinations, delusions, disorganized speech, disorganized behavior, anhedonia, and that's when individuals are unable to experience emotions such as pleasure or pain and report a sense of detachment from the environment. Alogia is the absence of spontaneous speech production for the purpose of answering questions or expressing oneself. And then avolition is a deficit in spontaneous or goal-directed behavior such as completing simple daily tasks. Looking at the diagnostic methods, it's diagnosed when at least two of the following, when the patient has at least two of the following symptoms. So delusions, hallucinations, disorganized speech, disorganized or catatonic behavior. Negative symptoms are experienced most of the time during a 1-month period with some disturbance present over the past 6 months. So in addition, one of the symptoms must be delusions, hallucinations, or disorganized speech. Here you have some conventional antipsychotic medications that are used to treat schizophrenia. Here you have a table from your textbook looking at the second generation atypical antipsychotics used to treat schizophrenia. Looking at the non-pharmacologic management strategies, psychosocial therapy can facilitate the management of schizophrenia. Cognitive behavioral therapy is a talking therapy that initiates cognitive and behavioral change based on individualized reappraisal of the person's faulty beliefs. It's effective in treating schizophrenics when stabilized with stabilized antipsychotic medications. Family support can also improve compliance with antipsychotic medications and therapy consistency.